Okay, hi guys. So Professor Gonzalez here. I'm going to go through the inline suctioning skill with you all. Basically, when you have a patient on a ventilator, it's a collaborative patient care situation. So you're going to have respiratory that's working with the patient, and you, the nurse, are going to be working with the patient. And of course, you have the doctor that's able to prescribe the different vent settings. But first of all, if you look over here, you have your ventilator. Your patients connect to the ventilator through these tubes here. And then we have set up an ET tube that's going down into the lungs to provide oxygen, ventilation. And then we also have an additional inline suctioning setup. So the inline suctioning setup connects to the wall suction. So basically, first things first, how do you know that you need to suction your patient? Well, suctioning happens for two different reasons. One, you do some maintenance suction, but two, you're also making sure that you have a patent airway is the bottom line. So you're trying to maintain the airway, and then also sometimes if you see your patient's not oxygenating well, maybe there's a high pressure alarm going off on the ventilator, that could mean that there's some excess secretions in the airway that you need to suction out. So if you are assessing your patient, you might hear coarse lung sounds. You might notice that they look uncomfortable. If they're not sedated, they might be sedated heavily. They might be, coughing or just looking like, they're not oxygenating well. Usually patients are going to also have continuous pulse ox, so that way you can see their oxygenation. So you might notice that their oxygenation, their pulse oximetry number is going down a little bit or a little lower. So there's a lot of assessment findings that might clue you that, hey, my patient looks like they need suctioning. Okay, so again, for the nurse especially, this is really important. Our job as a nurse is to make sure that they are getting oxygen, that they have a patent airway. Okay, so what do we need to do if we have identified a need to suction the patient? Okay, so first of all, of course, go in the room, hand sanitizer, gloves are a great idea. You could do your assessment. Now, one interesting thing about suctioning a patient, so really suctioning a patient technically is not a new skill to you all, right? The new part is that we're doing inline suctioning now, and it's connected to the ET tube. So really, principles of suctioning a patient, you guys did the trach suctioning, right? Those still principles apply. So the differences here, though, are how you pre-oxygenate and the fact that you don't need to get rid of this. So this setup here, the inline suctioning catheter is covered so that way it remains sterile. So you can actually use this setup multiple times. You don't have to discard anything after you're done suctioning. Okay, so before you suction a patient, you've learned about pre-oxygenation. What is great about our ventilators is that they have a button that you can temporarily increase the oxygenation to 100% for 2 minutes. So there's actually a 100% O2 button over here. So what I like to do, I think that's handy, you come in the room, patients on a ventilator, they make a lot of secretions. There's a tube and a part of the body that's not natural to be in, right? And so our body responds by making mucus, making secretions. So you're probably going to need to suction your patient pretty frequently, right? So you go in the room, you've looked at your patient, you've done your assessment, you've identified the need to suction your patient. So you could go ahead and press the 100% O2 button, and you're already started the process of pre-oxygenating them. Okay. so now we've got some nice rich oxygenation going on. So we want to suction. Okay, so on your inline suctioning catheter, you've got a button here that you could twist. So if you twist it one way, it's locked and it won't apply suction. You twist it the other way and you can press it down and apply suction. So this is actually how you turn on the suction. Okay, so we don't turn it on right away, but I'm just showing you. Okay, that's how you turn on the suction. So the next thing is you want to make sure that your tube is secure. We do not want any accidental extubations to happen. So make sure your tube is secure with one hand, and then you're going to identify your dominant hand, because it's easier to do it with your dominant hand. Okay, so what you're going to do is you are going to advance the catheter, and you'll know how far. You might see your patient responding just like they would if you were doing trach suctioning, that you get the cough reflex going on. So you advance your catheter, and then when you've hit just the right spot, this is unlocked now. So now you're going to press down on your suction, and you are applying suction now. And so you're going to start seeing all these secretions coming on up, and what you do is just pull back. Okay, so you can go ahead down again and suction your patient more. People always ask, like, well, how many times can I suction my patient? Like, am I only supposed to do once and then I have to stop and wait? And you know what? We told you guys at the beginning of the semester that this is going to be a little different for you guys, right? Because we're in gray areas. We're in higher level acuity, and we have different priorities at this level. So guess what your priority is? Your priority is oxygenation. So you need to suction to get those secretions out. So if it's once, great. If it's twice, great. If it's 3 times, so be it. But if your patient is struggling to get oxygen in them because there's that many secretions down there, then by all means, that's your priority. You need to get in there and get the secretions out, so that way the air that's going into the ventilator can get to the lungs, so they can start oxygenating well. So that is inline suctioning. So when you're done, you can lock this. You can actually disconnect this and connect it to a yanker, or if you have the mouth care swabs, that connect. They have the suction mouth care swabs. But you could just leave this connected. And then you want to offer some rich oxygenation, so you can press the 100% O2 button again and give them some more oxygenation. And it'll do it for 2 minutes, and then you've got the whole circle done. So that's the inline suctioning. So when you guys come in the room to check out the equipment, I want you guys to practice doing that inline suctioning skill, because that's a common skill that you would do with a patient in the ventilator. All right, that's it. Bye.